The Evo laser system incorporates Nd:YAG and alexandrite lasers, being a recognized gold standard in laser cosmetology. The Evo is a professional instrument for the following treatments: removal of almost all types of unwanted hair, vascular lesions treatment, pigmented lesions treatment, skin rejuvenation, acne treatment. For performing the above procedures in the most efficient way, we recommend to get acquainted with this video, which is a supplement to the medical guidelines provided with the Evo laser system. Attention! The treatment methods presented in the video are of referential and advisory nature. The information herein cannot and must not substitute medical personnel's professional decisions in each single case. Hair removal procedure. Laser hair removal mechanism lies in selective absorption of light energy by melanin contained in hair shafts and bulbs that leads to thermal destruction of hair follicles, while other skin structures remain relatively unresponsive to laser radiation. When the parameters are chosen correctly, it is possible to ensure maximum selectivity of hair follicles photothermolysis process and, correspondingly, maximum efficiency of the hair removal procedure. The main principles of medical protocols optimization when performing such procedures are the following. A hair responds to laser radiation only in the anagen phase. The number and growth rate of such hairs determine the required number of procedures and intervals between them for each patient. The wavelength should be selected depending on the patient's skin type, target area location, hair thickness and color, skin pigmentation and tanning, as well as the patient's racial and physiological traits. Pulse energy should be selected basing on the 5 joules rule when performing the treatment with the Nd:YAG laser and on the 3 joules rule when using the alexandrite laser. To increase selectivity of thermal effects, use pulse duration shorter than thermal relaxation time of the hair and its follicle, but longer than that of adjacent tissues. Recommended length of hairs for performing laser hair removal procedures is from 0.5 to 1.5 millimeters. To minimize patients' painful sensations during the procedure, cool the skin in the treatment area and control pulse repetition rate and spot size. Now have a look at the footage of hair removal treatment. Vascular lesions treatment. Laser vessels coagulation is based on effective absorption by hemoglobin of certain wavelengths radiation. Nd:YAG laser radiation is effectively absorbed by hemoglobin, but is considerably weaker absorbed by melanin contained in skin, that allows to reduce the possibility of negative skin reactions. This peculiarity allows to selectively coagulate unwanted vessels through the cutaneous covering while minimizing thermal effect on skin. The main principles of medical protocols optimization when performing such procedures are the following. When performing laser coagulation, efficient cooling of the treated area is obligatory. When the vessel is cooled, blood, being a chromatophore, can go out of it. In this case, it is necessary to wait for several seconds and make a laser pulse immediately after blood returns to the vessel. Depending on the size and color of the vessel, as well as blood pressure in it, use fluents within the range from 70 to 200 joules per square centimeter. For vessels treatment, we recommend to use 2 mm spot size. To increase selectivity of thermal effect, take into account that vessels of different size have different thermal relaxation time. Repeated pulse to the same target area can be shot not earlier than in 20 minutes after the first pulse. It is inadmissible to fire the third pulse to the same target area. Now have a look at the footage of vascular lesions. Pigmented lesions treatment. The mechanism of removing pigmented lesions lies in efficient absorption of alexandrite laser radiation by melanin in plenty contained in the pigmented spot area that leads to destruction of melanocytes. Residues of melanin-containing cells are gradually removed from skin due to phagocytosis ensured by fibroblasts and macrophages. As a result, in 3-4 weeks after the treatment, skin acquires its natural color. The main principles of medical protocols optimization when performing such procedures are the following. Start the treatment from 10 to 15 joules per square centimeter fluents. Darker spots better react to laser treatment and require less energy than fair ones. Use laser pulse duration within the range from 1 to 3 milliseconds. The smaller spot size is, the lower is probability of scarring. Pulses should cover the treatment area linearly with overlapping of about 10%. If the procedure is performed correctly, pigmented spots change their color. Darker spots become lighter, while fair spots become darker. If the color does not change, the chosen protocol is incorrect and the treatment energy shall be increased. Regularly, small spots are eliminated after one procedure, while for larger ones, 1 or 2 additional procedures can be required with about 3 weeks interval between them. Now have a look at the footage of vascular lesions treatment. Strictly forbidden. Acne treatment. The mechanism of exposure lies in absorption of laser energy by microbial shell, which leads to thermal destruction of propionic bacteria causing inflammations. In addition, laser radiation partially destroys cells lining excretory ducts of sebaceous glands, which reduces skin fat extraction and decreases skin oiliness. In other words, laser radiation blocks acne-releasing mechanism. Thermal effects produced by the laser improves blood circulation and thus brings leukocytes to acne focus, suppressing inflammation. Besides, It activates fibroblasts, which results in pores contraction, skin relief flattening, and as a result, to uniform and healthy skin color. The main principles of medical protocols optimization when performing such procedures are the following. Acne disease implies total skin healing. It is necessary to treat not only the acne area, but also seemingly healthy skin zones that contain barely visible focuses at the pre-inflammation stage. When performing acne treatment procedures, the whole skin area shall be covered in 2-3 passes with 10 to 15 minutes intervals. The first pass is made with 30 joules per square centimeter fluence. For the second and third passes, the fluence shall be increased up to approximately 35 joules per square centimeter. When performing such procedures, cooling is not applied as the aim is thermal activation and stimulation of fibroblasts. Unpleasant sensations during the procedure are inevitable. The standard spot size to be used is 8 to 10 mm, but for treating deep acne, spot size can be up to 12 mm. Optimum laser pulse duration is from 1 to 3 milliseconds. The treatment course required is from 3 to 5 procedures with 10 to 15 days interval between them. Now have a look at the footage of acne treatment. Attention! The described procedure, as a rule, ensures sustained remission. However, the patient must be aware that laser treatment will not cure acne, as it is a chronic disease requiring long-term and systematic treatment. Laser non-ablative rejuvenation of facial skin and décolleté zone. Exposure of cutaneous covering to laser radiation results in coagulation of hypertrophic vascular skin structures. Simultaneously with this, vasculature emits energy that positively affects fibroblasts' activity and density of collagen-containing skin layer, which in its turn allows to obtain evident rejuvenation effect without damaging cutaneous covering. The main principles of medical protocols optimization when performing such procedures are the following. When performing such procedures, cooling is not applied, as the aim is thermal activation and stimulation of fibroblasts. For the treatment, it is recommended to use fluence of about 15 joules per square centimeter at 5 to 7 mm spot size and laser pulse duration from 0.3 to 0.4 milliseconds. The recommended pulse repetition rate is from 10 to 20 Hz. If the protocol is chosen correctly, the treated skin upon completion of the procedure becomes warm and has characteristic pink shade without bruises. For the best effect, it is recommended to perform 4 to 6 procedures with 10 to 15 days interval between them. Now have a look at the footage of non-ablative laser skin rejuvenation.